Yes, hello, my good people. How are you doing today? Dominic here, and welcome to my healthy talk show today. So, today is a Friday, and as my tradition on Fridays, I always allow people to ask questions, those medical questions, so that we can be able to address them, right? So, today on my health talk, we want to talk about something. There is a condition we call halitosis. You ever heard of halitosis? Yes, we call it bad breath. You know, one of the difficult things to tell someone is unanuka mdomo, right? Ni ngumu sana kuambia mtu kuwa ananuka mdomo. Yeah. So basically, that's what we want to talk about today. Halitosis is basically bad breath, ama kunuka mdomo, maybe so you can call it, right? So a bad breath can be caused by different conditions. So I'm going to highlight around 10 possible causes of halitosis before maybe we talk about the preventive measures, right? So number one is what we call foods. Different foods basically can end up causing halitosis. How do they cause halitosis or bad breath? Sometimes people eat food and they get stuck on the teeth, on the oral cavity, and people don't end up brushing. So, especially foods that contain spices, acidic foods, the likes of garlic and the likes. So, when these foods get stuck in the mouth, sometimes they end up causing these kind of bad breath. Sometimes they get digested, go to the bloodstream, and then end up in your lungs. You breathe them out. As you breathe, that kind of bad breath comes out. That's number one. Number two is what called tobacco products, especially those people who are smoking, they end up getting a bad breath. Number three is what we call poor dental and oral hygiene. Kuna watu hata kubrush meno, they don't, right? So when you eat, you don't brush your teeth, some bacteria end up accumulating in your oral cavity, and this it ends up causing what we call halitosis or bad breath. Number four, I guess, yes, is what we call dry mouth. How does a dry mouth cause halitosis? Sometimes the saliva makes the mouth moist. But when you have a dry mouth, especially at night when we sleep, kwanza wale watu wanalala kama wamefungua mdomo, they end up having a dry mouth. That is why ukiamuka asubuhi, your breath is not fresh. It's because the mouth has been dry all the night long. So a dry mouth can also cause a bad breath. Number five is what we call medications. We do have some medications which have that kind of side effects. When you take them, they end up causing some bad breath in your mouth. So some specific medications, if you are on some medications, they may cause such kind of a problem. Sometimes infections, that is the number six. Infections, especially those in the oral cavity. Sometimes we have conditions like pharyngitis, laryngitis, even tonsillitis, especially those tonsils, some tonsillitis that has caused pus. It can cause such kind of bad breath. Number seven is what we call tonsil stones. This is a very common cause for bad breath. Tonsil stones, I believe some of you may know about it. On your tonsils, there are some pockets there, and when food debris get stuck there, they end up, causing that kind of breath. So tonsil stones is one of the culprits for bad breath. Another thing is sometimes metabolic disorders of the stomach. They can also cause this kind of infections. Sometimes what we call GERD. GERD is basically what we call gastroesophageal reflux disease. So when the gas and acids get leaks out of the stomach and comes up, sometimes you get heartburn and all that. It's one of the causes for a bad breath, right? And also some cancers, especially throat cancer, it can also cause such kind of bad breath. So basically, those are some of the main causes for bad breath, as I have highlighted them. Preventive measures basically is we normally advise proper oral hygiene. If there is a specific cause that you have identified, especially those infections, you treat them. If the tonsil stones, make sure you've got rid of them. If there is any, oral hygiene, make sure you brush your teeth, especially twice a day, morning and evening after you have taken your meals. So treating the underlying cause is the main key into treating halitosis, right? So if you have that problem, make sure you see your doctor, preferably your dentist, and you'll be able to get help, right? Thank you for listening. Thank you for watching. Health is wealth. Keep on subscribing to my Health Talk page. That is Osiemo Dominic. Keep on following on my page, subscribing to my YouTube channel, and all my social media platforms where I normally do my health talk. Thank you, and I wish you a lovely weekend and a good Friday.